Hi everyone. Thank you for joining us today for this webinar on virtual care, practical considerations for program implementation. My name is Patrick Charbonneau. I'm the Director of Product Management at TELUS Health for Health Benefits Management. And on my behalf and everyone helping here, I'd like to say thank you and that we're delighted to have you on the call today. So why a webinar on virtual care? Well, we know that virtual care is an important topic, one that is raising quite a lot of interest in healthcare today. And at TELUS Health, our mission is to improve the health of Canadians by enabling better collaboration across all the stakeholders of the Canadian healthcare system. And virtual care is perfectly aligned with this mission. Hence our interest and why our webinar today. So what can you expect out of this session? Well, you should have a good understanding of what virtual care is all about, and as well as its key considerations for plan sponsors. We hope that you find the next 45 minutes informative and fun. Let me introduce you to our guest speaker today, an expert in the field of virtual care, Yolanda Belinkoff, Head of Sales for Akira. Yolanda, welcome.
Thanks for having me.
We're delighted to have you. Let's take a quick look at what we'll be going through today. So I'll be starting off by giving you insights on some of the emerging employee attitudes toward virtual care and covering some of the market dynamics that influence it. And then Yolanda will be picking it up from that point and taking you through what virtual care is all about, preparing you for common questions that may come up, and give you practical considerations and hints that you may want to keep in mind as you prepare to implement a virtual care program. So as we get started, the first thing I'd like to do is actually take a bit of a step back and think of how virtual care fits in the current healthcare ecosystem and precisely the access points for primary healthcare in Canada today. We typically have, or we have, three primary access points, and they've been here for a while. You know them very well. There's, first of all, the traditional in-person primary care at your clinic, either through an appointment with your doctor, which can take a little bit of time for you to get that appointment, or a walk-in clinic for obviously not life-threatening situations. Second point, if you're off hours, after hours, or you need some guidance on, I would say, low risk health issues, telehealth is available for us as well, and it's implemented in different ways, shapes across Canada, but is there for you to either be triaged at the right point of access or, as I said, answer basic health questions. And there's also the emergency room. It's open 24/7, really aimed at acute urgent care, fully staffed, really the place to go if you have an urgent need. However, it is meant for those urgent life-threatening situations, and if you do go to the emergency room with a more benign situation, you will experience long wait times. So there's definitely a gap in accessing primary health care in Canada, meaning that if you do have a benign situation outside of the business hours, you're in for a wait. And that shows in some of the statistics that I'm about to share with you in a minute. So the first thing that strikes us in terms of statistics regarding access to primary health care is the fact that 61% of doctors share they have a hard time or are not able to accommodate same day or next day appointment. I would even share that I'm somewhat surprised 40% can, based on on my personal experience. I think there's definitely a struggle at that level. It may be explained as well by the fact that 4.5 million Canadians don't have a family doctor today. And so that number, 61%, should actually be, it's probably much higher if you consider the fact that a lot of people don't have a family doctor at all today. And that drives some pretty concerning behaviors. We see 40,000 Canadians going to the emergency room for issues that arguably should be dealt with elsewhere. For example, renewing prescriptions. Obviously something that should be dealt with at a clinic or through other means, but patients are willing to wait 4 to 24 hours to get that prescription renewal, which is obviously not a good use of anyone's time. Patients also report skipping appointments. 68% of patients report either skipping appointments or waiting longer to go and see the doctor because of difficulty in accessing and getting access to their family doctor. And that's going to drive bigger problems because we know that if you take an issue early on, the impacts are much less, and therefore the recuperating from it is much easier. That, combined with 74% of doctors saying that repeat or regular touch points with a doctor helps identify issues early on, is really a combination that's concerning, that can drive a lot more cost in our system. So so we do have a gap. And what does this matter to plan sponsors and employers? Why is this related to employers and plan sponsors? Well, it's because it is directly related to three of their biggest challenges and three of the things that matter most to them, which is A, having a workforce that is present, that is active; B, a workforce that is engaged, team members that are engaged in their daily work; and obviously talent retention. And that also behavior drives absenteeism. So we know, for example, that team members with 2 or more lifestyle risks are absent 50% more often, which is obviously an incentive for us to encourage regular touch points with healthcare providers who can influence those behaviors. Mental health, we know we live in a very stressful environment. That stress can come from work or even related to family events, but nonetheless, to have an engaged team, that stress level has to be addressed, and anything we can do to appease that element is important, because 60% of workplace absenteeism is stress related, so something we should really keep an eye on. And we know that having a very talented team is a key differentiator for any employer, and simply knowing that the cost of turnover is 21% of salary is yet another very tangible way to remind ourselves that talent retention is important, and anything we can do to make it more enjoyable to be at work, to come to work, and to participate is something we should really be inclined to do and focus on. And if those, I would say, subjective arguments don't completely convince you, well, here are some hard facts. 9.3 days a year. That's the average number of health-related absences per full-time employee last year. That's a huge number, very high number, and very significant impact on the productivity of our team members. 65 days is the average length of a mental health-related leave of absence. Now, recall previously we said 60% of absenteeism is related to stress, so high occurrence and very high impact. So anything we can do to relieve that stress early on and catch it early on can really have an impact on how much time a team member will spend outside of the work and how fast they can come back fully engaged and ready to participate. If you look at the very macro level, $16 billion a year in lost productivity is an incredibly high number, and in today's very competitive economy, something that we all have reasons to want to address. And if you're a parent like me, you know that simply getting to those medical appointments can be quite difficult, and parents typically take between 4 to 12 days simply to attend those basic health needs. So there again, in terms of employers and employees, anything we can do to make that process simpler for the team members and for the parents is something that will make their stress level reduced and also reduce the absenteeism numbers I just mentioned. So virtual care is not necessarily the silver bullet, but it can definitely help, and it's a technology that we think has a lot of promise. And to tell us all about it, Yolanda, take it over, please.
Great, thank you very much. So this is sort of a transition slide. So travel and wait time. So on average, people take 10 minutes to visit, a 10-minute appointment to visit your doctor. It can take about 120 minutes of a work day. So, love being Canadian. I think all of us are very proud of our healthcare system. But the one common theme that most of us have in common is that we have waited. We've waited excessively. We've waited for times with doctors where there was really only a conversation, and there's a great opportunity to make some change in Canada related to this. So now let's take a look at virtual care a little closer. So essentially, virtual care coming to Canada provides an opportunity to change the healthcare landscape. So this isn't unlike how Amazon has changed the shopping landscape or Uber has changed the taxi landscape. There's an opportunity for an employee to grab their phone, something that's near and dear to most of us, and go ahead and start a consult and have a medically credentialed, so an actual individual who's able to action healthcare be on the other end of that phone. So what happens when you have a virtual consult? What sort of things can the virtual care provider give you? So the first one is prescriptions. So this can be something where you have a health concern that needs a new prescription, or it could be something like you need a renewal of a prescription. We've all been in circumstances where, our doctor's office is closed or it's a weekend, and we feel it's quite critical because we're traveling or going, or it's the only time that works for us that we need this prescription. So you have the ability to do that. Both advice and diagnostic can be done right on the virtual care app. So we'll get into some examples later. But we always say to people, what are you doing Googling and trying to ask, the World Wide Web whether or not you have some sort of health concern, when you have an ability to have easy, on your fingertips access to a healthcare professional that can, let you know whether or not that is something that is serious or something that isn't, and that maybe will give you a diagnosis that you otherwise would not have received. And then there's all of these permission slips. So, Canadians know this well. Our friends in the U.S. don't have this as often. So if they want to go and get a test or see a specialist, they call up that specialist or they call up that lab and they do that. But that's not the case in Canada. So, we take multiple visits in order to have one outcome. So labs, specialist referrals, imaging, all of those things can be started on a virtual care app. So this could be, a blood requisition, a urine sample. It could be cardiology, neurology, multiple specialist referral. Dermatology is a really good one. But it could also be for ultrasound, x-ray, and other imaging. So, reasons for use. What are people using virtual care for? So the first one is, common episodic issues. So these are the things that sit on our list of things to do that we push aside, right? So it's the small healthcare problem that isn't really bothering us enough given the amount of barriers that are required for us to go to our doctor, book an appointment, go to a walk-in, etc. But from a plan sponsor level, you really have to look at if we can address small health concerns early, we have a better chance of having that not develop into something more complicated or more serious. So we want people to hit the button and get started. The other one that is very common as an episodic concern is cough, cold, and flu. And we're coming into that season, so that's something we see a lot. And actually myself, when I was first learning about virtual care, I sort of scratched my head about this one. Cough, cold, and flu, like when I have a cough, cold, and flu and I go to a doctor does actually touch me. So there was an interesting study done in the United States around people with cough, cold, and flu using virtual care. So obviously the doctor or the nurse practitioner on the other end is not able to touch your glands or, feel your head or do any of those things. So that means you as the patient are required to have an active participation in your healthcare. So you're touching your glands, you're checking the color of your mucus, you're doing all of those things. And they actually found that when patients had a more active role in their healthcare diagnosis, they were able to gauge whether or not they were getting better or worse more accurately than people that just closed their eyes and allowed their doctor to do what they did. So that was pretty cool as far as, looking at your healthcare. Mental health would be the next one. So this is actually a very common reason why people use virtual care. There's a whole host of reasons for that. There's less barriers for care. It's the second leading reason why we see this concern at Akira. The other thing that's, really fascinating about mental health is that sometimes people will start that consult assuming it's something else, right? So they might think, oh, I'm not sleeping, or, I've been having this weird pain in my chest, which actually may address an issue that they didn't know about. Skin conditions, this one's, a great lane for virtual care. You can take a high-resolution photograph of that mole, that rash, that skin irritation, and potentially get the treatment that's required for that. Medication renewals. So the renewal process is actually something that is not funded by most provinces. So this means it is not uncommon to have an employee who has paid for this service if they wanted this convenience. So, I've had multiple employers tell me that they've had patients or employees say that they paid between $20 and $35 to have their doctor renew this by the phone. And if they didn't want to renew it by the phone, they'd have to physically book a scheduled appointment with their doctor, travel, wait, and stay there so that the doctor had the ability to bill the province. Childcare, so, Patrick made some good points about childcare. I too am a parent, and I'm, lugging, putting kids in snowsuits, getting them in the car. And so when you can bring some of that down, that's excellent. And then when you're outside of the country, so as much as virtual care is provincial based and when you can prescribe or write referrals, you can get advice anywhere that you are in the world. So you can launch your app when you're in the United States and have a discussion on whether or not it makes sense to go to a U.S. carrier. Maybe this is something you could do over the counter. Maybe it's fine for you to wait till you get home. And in other parts of the world, you actually can go and access that prescription medication without needing a piece of paper. So you may be able to get that right with the help of your virtual care provider.
Yolanda?
Sure.
Hi, this is Mary. We do have a question that came in concerning prescription renewals. So shouldn't pharmacist abilities to do this within new scopes of practice minimize the need for patients to attend ER to do this? And this also refers to something Patrick said in his first few slides. Or are pharmacists not practicing to their scopes, or are these high numbers for controlled drugs?
So controlled drugs, I don't think are in that number. So generally, virtual care, just as an aside, do not write controlled substances on a virtual care app. So I don't know province to province as far as pharmacy scope of practice, but generally a prescription still needs to be written by a nurse practitioner or a family practitioner or a family doctor in order to get that prescription done. I know there has been some discussion around renewal, but I don't believe that a pharmacist is able to renew a prescription without a requisition from a nurse practitioner or a family doctor. So they can be the one, the pharmacist can be the one to phone in to the patient's doctor's office. Now let's just sort of walk through that, right? So you're a pharmacist, the person says that their medication needs to be renewed, and they have this ability to call the doctor's office, fax it through, so it's still cumbersome. But as far as pharmacists writing prescriptions, I think that there is some potential there. I don't know the rules specifically.
Thank you. We have also a second question. How do you define a mental health related leave of absence, and what are some of the examples of diagnoses involved?
Mental health related leave of absence? So I don't know how I would define that. I think it really depends on when an employee chooses to come off work. And so, we do know that employees do come off work for mental health. It's actually a very common reason for people to go on short-term, and it's an even more common reason for people to be on long-term disability. Specific cases, I think, would be personalized depending on the employee.
Thank you.
So now let's look at insights. So TELUS went ahead and surveyed just over 1,500 employees, and they asked them what they thought of this category. So no surprise, millennials were, interested in this, right? So they use their phone for everything. And so 50% of them said, yeah, hey, I want to do that, right? Like, why wouldn't I want to have an appointment that way? And these people aren't even sick yet. They're too young, right? But then when we looked at the overall group, so all age categories, still almost half of them said that they thought that this would be a way of saving time, at least time where they wouldn't have to take off work. So they see the convenience and the time savings in doing this. In that same group, so in the total population surveyed, about 1/3 so that they think that it would decrease their stress. So Canadians actually feel some stress related to trying to figure out, how am I going to get to the doctor? Who's going to drop my kids off? Where am I going to do with this meeting? All this sort of stuff. So all of those go away when you have the ability to have this virtual care appointment. And then to address that sandwich generation, so, that individual at work who has aging parents and young children sandwiched in the center, 70% of them reported that a service like a virtual care would really make a difference on how they are able to support their family. So now look at reasons of use, or, the applicability. So essentially, virtual care is something that we say, if it's not an emergency, you can start with virtual care, right? And even, I'm a good example of this cough, cold, and flu. I thought, well, geez, I feel like a doctor would touch me on cough, cold, and flu. But a doctor doesn't necessarily have to touch you with every cough, cold, and flu. So you've got this ability to launch a consult, and the worst that happens is you spend 15 minutes of time, and, the very informative nurse practitioner or doctor that you were speaking to suggests that you go to a bricks and mortar, right? So give it a try, put Google aside and go ahead and use that service. And actually, in the United States, there's a healthcare system called Kaiser Permanente. So they manage in about 8 different states almost 12 million patients who have a family practice need, and 52% of those patients who had a reason to go to the doctor at a primary level were instead treated virtually. So that's a good argument to say at least half the time that we are going to the doctor, we probably could use this modality instead of a bricks and mortar modality. The other thing is that when you do go on to virtual care, you have this ability to have a text conversation. So, most of us feel somewhat uncomfortable about a video, and so you can actually resolve some concerns by just text. So at Akira, we actually found about half of the interactions that we had through the app were done via text and with pictures. And then we have about an 80% resolution rate at Akira. This is probably a little bit high, but somewhere in and around 70 to 80% is what you can see resolved. And this is because people are generally pretty smart about what they need to get done on virtual care and what they're trying. And then again, mental health. So as I'd mentioned before, the second leading reason why people come on, hit start a consult, is to address something related to mental health.
We have another question. How close are we to get a new script via virtual care? Do you see this happening in the next 5 years?
I'm sorry, can you repeat the question?
Yes, of course. How close are we to get a new prescription via virtual care? Do you see this happening in the next 5 years?
So you can get a new prescription via virtual care. So now, not everything will be able to be prescribed on virtual care. So as I mentioned, there's some limitations. So, narcotics are not prescribed in virtual care settings. There are times when you do require a bricks and mortar, so a physical examination. Well, you're not going to get that prescription for the first time. But things like mental health is a great example where, sometimes you can't get a prescription like that by going to a walk-in clinic because there is not really a guarantee that you're going to be coming back or there's any follow-up. But on some of the virtual care apps, which includes Akira, our nurse practitioners will write a prescription for a mental health, so an anxiety or depression can be written for the first time right on the app.
Thank you.
Okay. So, how does it work? So, is it difficult? How does it work? So here's an example of Akira's interface. Some of the interfaces are slightly different. Some virtual care apps are easier to use or more integrated than others, so it's worth sort of looking at what you've got. But generally, as far as use, you want to be able to hit a consult, so that big blue button, and then you want that consult to start. And then you're having real-time text. So, you text, and then these bubbles come up when it's time for the clinician to text, so you can have, an asynchronous conversation. You can see here that a photo was taken, so this could have been from your photo library, or you could have just grabbed your phone and taken a snap of that skin irritation or rash right there. And then there could be an opportunity to launch video. So again, you can hit the video link and boom, the video has started for the two of you to have a conversation. And then there is a place within the app where all your health records are stored and your receipts. So if you ended up purchasing something, that would also be all within the same app. So very easy to use as far as button to button. And then this next slide looks at some real case examples. So, we'll walk through them as far as, examples of where you can use them. There's lots of ways that you can use it, but these are three that I picked. So the first one is a gorgeous little boy of actually someone who we work with, and he was stung by a bee. So his mom has a very good relationship with her family physician, and she did choose to take him there. So she took him to the doctor. An antibiotic was written for the bee sting, but now the swelling has not come down, and mom is nervous, right? So this can be after hours, and so, what do I do? Do I go to a walk-in clinic? Do I let Alexander go to sleep? I'm feeling nervous. I feel like I need some peace of mind as far as what to do with this boy. So we can start a consult, easy, start the video. Son was super excited that he got to be on video, and between the nurse practitioner and the mom, they decided to do something that was at the local pharmacy, and so mom went to bed feeling like she had peace of mind. The second one is a prescription renewal. So this is an example of a text-only circumstance. So this is a fairly common prescription renewal. This is a migraine medication. This client had been on migraine medication for 6 years, has been happy with this brand, has really had no concerns related to it, doesn't use it all that often. And so the nurse practitioner went ahead and wrote that prescription to their local pharmacy, picked it up, boom, they're on vacation and happy, and away they go. And then the third one is a mental health case. So again, you can see that this starts as, geez, I'm feeling a bit anxious. This has been something that has been concerning to this person since they were a teenager, but it seems to be getting worse. The part of this example that I really like is that the nurse practitioner asks whether or not they can have a video conversation. So we at Akira do not have an interaction related to mental health at the prescription level unless you are going to launch a video. So it's not the kind of thing that you could write a text for, like the prescription renewal example beside it. So in this case, we need to launch a video. So this employee said, actually, could you give me a few minutes to find somewhere private? So this is an excellent opportunity. The person can go and book a room, maybe at their place of work and close the door. Maybe they're going to walk down to the park, or maybe they're going to tell us, you know what, I just can't do it until 8 o'clock at night when I come home, or until 9 o'clock at night when I put the children to bed, and that's no problem. So we'll wait for you. You can come back. You can do what you need to do. This little embedded link here, you have a video call, boom, you click that link, have the call, and this patient was prescribed for the first time anxiety medication. And there is a note here that the nurse practitioner will follow up in 2 weeks, because those who know anything about mental health know that it's not, a one-size-fits-all. It's not so easy to get the prescription right the first time. And so this allows that relationship where there's going to be follow-up, and they're going to maybe change things, add things, talk about allied health professionals, maybe bring in the EAP provider. Lots of things can happen related to this case.
So we have a question, Yolanda, about travel. So while traveling in other countries and using virtual care, obviously communication will be online and in English. And if virtual care can renew your prescription, will it be in the language required so that it allows you to take it to a local foreign pharmacy?
No, so Akira would stay in English. So you will be in a different country, but your Canadian practitioner will still be in Canada speaking English to you. When I had said that you could potentially get a prescription, it wouldn't be a renewal that you would actually do at a pharmacy level. So if you took a prescription renewal from Akira to a U.S. pharmacy, that would not work. So you can't do that given the governing laws right now. So what you could get if you were in the United States is, geez, I think that this is something that you could probably use an over-the-counter drug for 2 days until you come home. Again, this is just an illustrative example. I'm not a medical professional. Or it might be that you are in another area of the world. So maybe you're in Mexico where you don't need a prescription, and instead that nurse practitioner can say, there is a drug called this, you can go buy it yourself. So I don't know if you've ever traveled to any of these countries, but you will see when you're going to the pharmacy that there is no barrier to getting prescription medications. You actually can just select it without a prescription.
Okay, and one more question for you. Is there continuity of care, meaning does the user have access to the same nurse practitioner, or is it a new one every time they access the app?
This is an excellent question. You got ahead of my checklist. So we have a checklist at the end. So there are more than one virtual care provider in Canada, and this is a critical question to ask. So, when we look at what a plan sponsor is looking for an employee benefit, that one really hits the top of the list, right? This continuity of care, this dedicated relationship that will tease out, maybe you used it the first time because you had a sinus infection. Maybe you used it the second time for your son's skin irritation. But maybe you'll use it the third time for something that has been embarrassing or is mental health related, because now you have a person that's dedicated to you. So at Akira we do that, but it's an excellent question because not all companies do that.
Thank you.
Okay, so now we're looking at utilization. So, how do you launch a program? So this slide is really important for both carriers and plan sponsors and benefit consultants. So we really believe that this area of an employee benefit does better with better rollouts. So this is an opportunity for the consultant to really shine, right? So when you slap a benefit in and sort of bury it into page 3 and it launches with everything else, you probably won't have a good activation rate. But with some minor education, maybe some sharing of stories, you can really influence how people use this. And the other thing that we know is that when someone has downloaded the app and used the service once, their chance of using that service again is really great. So we want to make sure to work with the company to have a high activation rate. So I recently did an employee education session where we timed the activation link to be half an hour before the session. So I actually left 5 minutes in the session to say, for those who feel comfortable, grab your phone now and activate the Akira link so that you know where it is when you need it. And 87% of that group went ahead and ensured that that app was on their phone. We can do things like education material in the lunchrooms. You can have plasma screen, digital images. So all of these things, there's a learning curve as far as how to do this, and we think that the consultant and the carrier have a big role to play in having this done well. So then the next question is really around who's going to use this innovative benefit, right? So, are you going to have 100% of employees use it? Probably not, right? I don't think there's many employee benefits where you have 100% usage. But what this is illustrating is the usage that we see by age at Akira. So you can see those little bars that go all the way into the 80s. And actually, we have to edit this because last week we had an 87-year-old man join Akira. So it goes to show that, technology is here to stay and that people are learning to use technology to enable so many things. So in this case, the mean age is 24 to 45, but we've got lots of people in the older categories that are adopting. And this one, so ROI, that's always the big question, right? What is the ROI? And this is trickier in Canada than it is in other parts of the world, in the US, for instance, because of who pays for healthcare, right? So the employer is essentially, saying, okay, I'm going to take a virtual care modality to make, healthcare more convenient and accessible and innovative, but geez, doesn't the government pay for this, right? So it means that the payer is changing slightly. The other thing is that we're still really in the first inning in Canada as far as what the results are going to be in our country. But here's what we do know. We do know that when you have the ability to pull out your phone and hit Start Consult, you have a safe triage, an open door to start your healthcare journey. So, let me explain this. So you've got someone who's got pain, right? They start shopping through their paramedical spend. So they're going to physio, they're going to chiro, now they're being hypnotized, maybe they're trying, an over-the-counter medication. They're sort of self-diagnosing, maybe they're Googling or they're asking 3 friends, but they haven't really gotten to the source by having a medical professional suggest what they need to do. So in that case, they may have spent hundreds of dollars in their paramedical spend when really having a consult with a company like Akira may say, you know what, I actually think you need an image for this, or this is a prescription that's required to get started here. Mental health is another great example. Multiple things might be tried before you actually get to a point where you see a medical professional. So getting right to the source, it doesn't mean paramedical spends won't get used, but they're going to be used more efficiently, and there will be a plan of care. The second one is around just this decreased cost. So, we as plan sponsors and carriers really need to work on bringing down the barriers for healthcare. So be it time, travel, embarrassment, Canadians are not accessing healthcare as early as they could, right? And we all know that in order for short-term and long-term disability numbers to go down, we need to get to the source as early as possible. And they actually have done work on having someone on short-term disability get, patient-centric care, case management, easy access, health care, and those people come off disability much faster than those that don't have that. Now imagine if we did it before disability even started, right? Where people actually felt that they were able to conquer their concern before it ever got to a point where real leaves were happening. And then the last one is really just better long-term health and wellness. So, having a health service that is client-centric, that is, mobile-friendly, that's 24/7, that's on demand, all of those things, our government would love to be able to give us those things, but the purse strings, the wallet does not allow that amount of resources. And so this level of care, at Akira we use a word called, we're a physician extender service. We're really taking, what already exists in Canada and just adding that extra layer of care. And then, we will address what's happening in the U.S. because I think it's an important part. It's an important part for lots of reasons. Number one, they had a head start, so the U.S. has had a few extra years on us, so it'll show us what could potentially happen in Canada. But the other thing is I'm sure many of the carriers and consultants on this call work with plan sponsors who have both Canadian and U.S. Employees. So right now, we know that 60% of large employers in the United States have already adopted a virtual care program. And by the end of 2019, 96% of U.S. employers will have a virtual care offering. So what does this mean? It means clearly this is working. If they've started 3 or 4 years prior to us, now 96% of employers are adopting this service. But it also means that for those who support companies that are North American-wide, there's going to create this disparity, right? Like, oh, wow, one more thing that the Americans have that we don't have in Canada. And now let's just talk a little bit about account setup. So typically this is a classic employee benefit. So that means the employer is the one that's paying for this service. It does require an activation link, so it's usually sent by an email, and then the employee needs to open up that link on their mobile device. So be it iPhone and Android, it doesn't matter, Google Store, Apple Store, it doesn't matter. They download the app, and then they're filling in their family information Most of the services are offered as a family plan, so under the age of 25, living in the same household, and each individual has their own medical record unless they're children, and so that's fairly commonplace as far as account setups. So this is the checklist. So the checklist that we talked about. So, as I'd mentioned, this is an area, and Patrick had mentioned it too, and actually, I don't know if many of you know this, but we have almost 500 people registered for this webinar. So it goes to show that this is a very popular topic in the area of health and wellness right now. And so when that happens, there's several vendors that pop up. So it's important that when you're looking at what virtual care provider to align with, that you've got a bit of a checklist. So this is our start at a checklist. You can change these as you wish. They're not in any particular order. Essentially, it's alphabetical. But the first one is accessibility. So essentially, when you hit start a consult, does a consult start? So, at Akira, we believe that's table stakes, right? Like if an employee is going to go through learning, downloading, doing it, they don't want to book an appointment later in the day. They want to start just like they shop on Amazon or order an Uber, right? And then the next one is asynchronous care. So this ability to have this texting, right? So do you have to launch a video even if it's conversational? Do you have to download something to do that? So we think being able to just have that low barrier, boom, start a text is really important. Client feedback. So, it's worth checking the App Store, checking references. What are people saying about the particular virtual care service? Customization. So, depending on whether or not this is the carrier level, is there a white label opportunity? Is there an opportunity to customize maybe at the plan sponsor level? So, we have some plan sponsors who say, well, on the discussion around mental health, you want to ensure that an employee is aware of our EAP. Or you may have an employer who says, I want sick notes to be accessible on the app, and others that say they don't want sick notes to be accessible on the app. So you want to be able to ensure that you're picking someone that has the ability to be flexible. Escalation. So what happens when that person isn't able to have a virtual care consult? So, in that 20% or 40% chance that it really is a bricks and mortar appointment, does that provider that you've chosen have a plan for that? So what's their clinic experience? What are they going to offer people as far as another place to go? Follow-up care, so this was addressed earlier. So, does the virtual care app, did the professionals reach back out and say, hey, how are you doing? How are you feeling? Is there a relationship that started there? Or is it a siloed transaction? Medical credibility. So this one, on a surface level would be, are the medical professionals who do the consults credible? But secondary to that, is the business scaled by a medical company or a technology company? So you want to ensure that the infrastructure of the business is backed medically. Mental health, does the virtual care service have a mental health plan? So, it would be nice if it was a cut and dry strategy that everybody just needed one prescription, easy peasy, done. But we all know that's not true. We also know that mental health is a very important topic at the plan sponsor level. So what is the overall ecosystem in relation to mental health? And then the last one is the scope of practice. So what's the resolution rate? Are people feeling that they're leaving the service without answers? Is there a place for them to go? Are they feeling resolved? And that's it for my talk today. I appreciate the questions, and I'm happy to take more.
And thanks for sharing your expertise with us, Yolanda.
Thanks.
So as Yolanda mentioned, this is it for the presentation part of our session. We're obviously open for questions. And Mary, do we have some already lined up that may have come up in the later part of the presentation?
Yes, we do have quite a few. So the first one, what about the provincial funding barriers for physicians to bill for text care to patients?
Okay, so I will take that question. So there is some areas where there is a fee code for some virtual care. So this is very limited in scope. So if you think about how the provinces would roll something like this out, you can appreciate that by bringing down the barriers for care, the country has an ability to actually really escalate some fees in relation to healthcare. So instead, what's happening is if you think about a doctor's schedule, so they are open between 9 and 5, a patient can take a time slot. So, they're coming at 2 o'clock. They can have a 2 o'clock time slot either in person or they can have it virtually. It doesn't mean that they're not going to wait for that appointment. What it is going to do is it's going to minimize them, maybe infecting other people in the waiting room and having to park and drive there. They're also not going to have follow-up care. They're not going to have, an innovative interface. It'll probably be a desktop and a video as far as how that service is done. So as far as the employee benefit and having that patient-centric approach, that is not something that we anticipate the government being able to take on anytime soon.
Okay. Next question. What are the privacy risks of the implementation of virtual care can experience in Canada due to the privacy legislation?
Okay, so I'll take this one too. So any healthcare clinic in Canada is legislated at the provincial level in relation to privacy. So it doesn't matter if you're a virtual clinic or a bricks and mortar clinic, you do have regulations that you need to follow. So we of course follow that, as do all the other virtual care companies. There is also another level of privacy that is the governed legislation for the Canadian, at the Canadian, so the federal level, for digital. So again, we have that. So what does that mean? It usually means annual audits. It usually means, having to have encrypted data. Where your data is stored is generally in Canada. I think most of the companies are moving towards having their data stored in Canada. And then depending, again, when you're doing this checklist, it's worth looking at, are they looking at having any deeper levels of privacy? So, maybe they have, instead of having only yearly audits, they have audits more often. Maybe they're going to deeper levels of privacy checks. So there's lots to sort of investigate when it comes to that, but at a bare minimum, these virtual care apps are at least as safe as going to your bricks and mortar clinic.
Okay. How does this service integrate with my family doctor to ensure full knowledge of my medical situation?
I'll take that one. So in terms of telehealth, our strategy is, as I said, to increase collaboration between stakeholders. Today, the virtual care solutions don't actually send information back to your family doctor through the electronic medical records, for example. They really don't. They operate on a more of a standalone basis. Our plan is actually to open up APIs to enable virtual care providers to link back that information through, obviously, secure mechanisms back to EMRs, so that, yes, they can make their way back to your family doctor and have that, I would say, second level in terms of continuity of care that Yolanda mentioned earlier. So that's part of our vision at TELUS and why we're involved in virtual care, although we're not obviously developing virtual care solutions specifically.
Okay. Does virtual care qualify for healthcare savings account?
I can take that one. So from my understanding, it's not currently an HSA eligible expense, and that has to do with the membership component of how a virtual care program is set up.
Is there any public funding for this?
So, as we mentioned, there are some provinces that are playing with virtual care in some capacity. We're also actually, Akira specifically is working with a governing body around looking at maybe some specialist care, some home care. So I think that there's probably some niche areas where the government may put aside some money. We don't foresee it being something that would be similar to an employee benefit with all of the benefits that we discussed.
This will be the last question as we're coming to the end of the webinar time. What would be the typical wait time to connect for an on-demand consult?
So that is also an excellent question, and that is going to change depending on who you choose as your vendor. So at Akira, we say that you start a consult in under 60 seconds. There are some companies that don't actually even have that on-demand option. So you would go on. You may even have an AI person, a bot essentially that you book an appointment with for later. So that's sort of a vendor-to-vendor related question.
Thank you.
We went through all our questions for now, Mary?
Actually, we have a few more, and
Okay.
People are welcome to send their questions to tellushealth@tellus.com, and we will be happy to answer them.
Absolutely. Either those that we haven't answered or those that you may come up with in a couple of hours or after the session. Feel free to share them, and we will get back to you. So I want to thank you for your time today. Definitely enjoyed having you on the call and having all those questions. If you do want to share the fact that we do have a webinar tomorrow, actually, in French. So for those of you who want to join us, please do. Obviously, very similar topic, but we'll cover all our bases with a French webinar tomorrow. So thanks for your time.
Great. Thanks very much. Have a great day.
Ladies and gentlemen, this concludes the TELUS Health Virtual Care webinar. Thank you for your participation and have a nice day.